Bill, third reading.
Mr Speaker.
The Honourable Tony Ryle.
Mr Speaker, I move that the New Zealand Public Health and Disability Amendment Bill be now read a third time. I'd like to start by thanking the Chair of the Select Committee, Dr Paul Hutchison, and the members of the Health Committee and staff for their work on this bill. And I'd also like to acknowledge the Parliamentary Council Office and the Ministry of Health for their support to the committee. Mr Speaker, the bill and its supporting regulations provides the statutory environment to improve the coordination of resources across the district health boards, reduce bureaucracy, improve frontline health services and improve value in the public health and disability sector. The bill is consistent with the government's pre-election commitments, where we said we would make improvements to the public health service without the distraction of massive restructuring, and this bill does that. We can indeed be proud of our public health service in New Zealand and its many achievements, as evidenced by the recent improvements in the nation's health targets. Emergency departments are seeing more patients faster. In the last year, the number of patients admitted, discharged or transferred from an ED within 6 hours jumped from 81% to almost 90%. Elective surgery, where district health boards delivered 105% of their target, record numbers of patients are now getting surgery. Shorter waits for cancer treatment. 99% of all patients received their radiation treatment within 6 weeks of their first specialist assessment. And in the third quarter, 11 DHBs achieved 100, and in the fourth quarter, 17 DHBs achieved 100%, and next year this target moves to 4 weeks. Increased immunisation. The national target of 85% for 2019 was exceeded, with 87% of New Zealand's 2-year-olds fully immunised. And in the last year, Mr Speaker, Lakes DHB jumped by 22%, Mid-Central by 13%, and the Waikato by 12%. Better help for smokers to quit. There were significant gains over the past year in District Health Board staff providing smoking cessation support to hospital patients who smoke. However, there is still plenty of room to improve, and the results for the diabetes and cardiovascular services showed steady improvement, with the biggest annual improvement by the Whanganui District Health Board, 14%, and Counties Manukau, 10%. But as noted in the report of the Ministerial Review Group, there are a number of major challenges facing the public health and disability sector: an ageing population, the health workforce issues, service vulnerability, financial sustainability and cost growth. And the system itself, set up under the New Zealand Public Health and Disability Act 2000 and inherited by this government, can at times hinder performance improvement. It does not provide the levers needed to optimise value for money and deliver a health service that meets the needs of New Zealanders into the future. It actually stands in the way of system-wide change, and it slows coordination between district health boards, which is needed if they are to significantly improve their performance. It has encouraged localism at the expense of overall coherence and performance. There's too much fragmentation. 20 district health boards repeatedly reinventing the wheel 20 times has frustrated both this government and the previous one. We need to get the public health and disability system acting as one system, with hospitals working more closely with each other and with primary care and community services. Hospitals must collaborate better across regions and nationally. Decision-making must become less fragmented and made at the right level in the health service, so that there is better prioritisation nationally and more efficient and effective use of our limited resources. In particular, we need more cooperation across DHB boundaries, and this bill will help meet these by firstly improving sector planning and decision-making by supporting district health boards to undertake smoother, more effective and better balanced planning across the service at national, regional and district levels. Better national and regional decision-making supports rational and cohesive service and capacity planning, and DHBs will then be better placed to grow and protect the vulnerable health services. Secondly, accelerating improvements to quality and safety by establishing an independent Health Quality and Safety Commission. The Health and Disability Commissioner is reported as saying that progress in this area has been slow and patchy under the present arrangements. The new commission will be led by clinicians, and it will help organisations across the whole health service improve patient safety and service quality, including public and private, secondary, primary and community levels. A Peter Davis study found that 13% of people admitted to hospital suffer an unintended injury caused by healthcare that resulted in some disability. Even a 20% reduction in errors, Mr. Speaker, could save us approximately $100 million a year, money that could be reinvested into frontline services, and we want gains in better and safer care, better results, better patient experiences, and we want clinicians to lead this. The bill will also minimise administration costs and reduce bureaucracy and waste in the public health service by supporting shared administrative support and procurement services across the public health service. This will reduce the cost of DHB back office functions, with savings estimated of up to $700 million over 5 years, and that money will be crucial to help us maintain and improve frontline services over the next few years. Specifically, the bill amends the DHB objectives and functions so that DHBs are required to work collaboratively to meet national, regional and local service needs, creates a new planning framework supporting DHBs to plan across national, regional and district levels, provides the Minister the power to direct DHBs regarding how administrative support procurement services within the service should be obtained and who must provide these services. This is so that we can make sure that there are no holdouts if we want to have a national approach. And it provides the Minister of Health power to give direction to all DHBs to comply with stated requirements for the purpose of supporting government policy on improving the effectiveness and efficiency of the public health and disability sector, provides dispute resolution measures to support DHBs working collaboratively. As I said, the bill establishes the Independent Health Quality and Safety Commission, which will advise the Minister on health epidemiology and quality assurance matters, determine quality and safety indicators, and lead and coordinate the work for the purposes of monitoring quality and safety across the sector, and perform the other functions of quality and management that are assigned to it from time to time. And it also enables DHB elected members to be appointed to other district health boards. The government, and indeed all New Zealanders, want a strong and sustainable public health service, one that works successfully at both a local, regional and national level, where the planning and the service delivery is well coordinated, where we can enhance the quality of health care and reduce the duplication of corporate and administrative work. Mr. Speaker, this bill will help us change administrative functions and the way the health service works to reduce bureaucracy, to provide a greater focus on more important priorities, and I commend the New Zealand Public Health and Disability Amendment Bill to the House.
The question is that the motion be agreed to.
Mr. Speaker.